Family and domestic violence is a major health and welfare issue in Australia. This occurs across all ages, socioeconomic, and demographic groups. This refers to ongoing, past, or present abuse by an intimate partner or ex-partner. A 2020 report from the Australian Bureau of Statistics found that family and domestic violence-related sexual assaults increased by 13% from 2019. For a lot of victims, the COVID-19 related lockdowns added significant trauma to their overall well-being. This time consequently led to an increase in the severity of abuse, with increased incidents of physical violence and social withdrawal. Domestic violence commonly presents with coercive, controlling violence, which aims to disempower the victim through threats, intimidation, isolation, emotional abuse, economic abuse, abuse of children, assertion of gender privilege, denial, and blame. Often, but not always, these can be reinforced by physical assaults and sexual abuse. The less visible acts of violence, including emotional abuse, are suffered by the greatest number of women. This form is very subtle. It can be missed by healthcare professionals due to the level of manipulation and control the perpetrator has over the victim. The causes of family and domestic violence are complex. They relate to the gender inequality and community attitudes to women. Factors such as, but not limited to, intergenerational abuse, childhood exposure to violence, substance misuse, and mental illness are all associated with family violence. These factors influence the risk of an individual either becoming a perpetrator or victim of family and domestic violence. 1 in 3 hospitalizations for assault injury are due to domestic violence, with the perpetrator being the spouse in 2 in 3 cases. 3 in 10 assault hospitalizations of people aged 15 and over were due to family and domestic violence. In 2015, mental health conditions were the largest contributor to the burden of disease in Australia. Child maltreatment and exposure to domestic violence is associated with substantial adverse effects on the development of their mental and physical health. Victims of domestic violence have an increased risk of homelessness. 42% of people accessing homelessness services in Australia were fleeing family and domestic violence, 78% being women. Indigenous Australians are 34 times more likely to be hospitalised for family and domestic violence compared to non-Indigenous Australians. In 48% of these cases, the spouse was the perpetrator. Family violence within Aboriginal and Torres Strait Islander communities is a critical social issue that has a large burden on these communities. Family violence against Indigenous Australians is understood as both the cause and effect of social disadvantage and intergenerational trauma. All matters of domestic and family violence fall under the Domestic and Family Violence Protection Act 2012. Domestic violence is defined under Section 8, subsections 1 to 3. This legislation outlines the goals to reduce and eventually end domestic and family violence. Domestic violence is also defined under the Criminal Code Act 1899 under Section 1. Section 315A defines the nature of a crime in a domestic violent relationship. Domestic violence victims can apply for a domestic violence protection order under Section 23 and 32 of the Domestic and Family Violence Protection Act. Section 56 of this Act outlines the standard of conditions a court would impose on the domestic violence protection order. Depending on the nature of the case, other conditions can be added. Failure to abide by the order can result in criminal charges. Ambulance officers are governed by the Ambulance Service Act 1991. Section 3D outlines the service's functions. Subsections 1H and K allow paramedics to refer patients to other health services and collaborate with the hospital and health services. Queensland ambulance officers are provided with clinical practice guidelines. These govern their practice and act as clinical advice. For domestic violence, the Queensland Ambulance Service Clinical Practice Guideline for Suspected Abuse provides officers with information on how to identify and respond to all forms of abuse. Paramedics are offered a unique position to identify domestic and family violence. As they enter people's homes, they can gain insight into the dynamic of the home environment. However, they are inadequately engaged by the legislation. Research indicates that many paramedics in Australia are not confident in their awareness and treatment of family and domestic violence. The Victoria Royal Commission into Family Violence outlined that both New South Wales and Victorian ambulance services lack comprehensive guidelines for the assessment and management of domestic and family violence. In hospital, family and domestic violence victims can receive support from specialised healthcare professionals and referrals to services. The reality is, many domestic violence victims never make it to hospital. When a paramedic does not recognise domestic violence in the pre-hospital setting, there is a missed opportunity to break the cycle. It is evident that the current domestic and family violence procedure for paramedics is inadequate. Paramedics require more specialised training. There is a duty of care for all healthcare professionals to better understand the science of domestic and family violence. There are many online domestic violence services in Australia. However, they require victims to be proactive in seeking this support. By developing an information card that has general information on how to access domestic and family violence services and support, paramedics can assist victims to take the first step in seeking help. This card would be strategically designed to resemble a post-paramedic support card. Both sides of the card will look similar to make it difficult to distinguish between the front and the back. On the back, there is two sections, one that says support for you with the numbers for 1-800-RESPECT and DV Connect, and the other will say support for the kids with the contact for Kids Helpline. In doing so, we are reducing perpetrator suspicion by not using keywords and aiding in reducing the domestic violence burden of disease. The annual cost to the Queensland economy for domestic violence is approximately $2.7 to $3.2 billion, while the cost associated with developing the Domestic and Family Violence Information Card could be marginal in comparison. Considering the potential the card has to reduce domestic violence, the cost of implementing it could lead to a reduction in the overall state cost of domestic and family violence. One of the biggest considerations for the implementation of this strategy is navigating the ethical dilemmas. Ethics is a crucial branch of healthcare that guides safe medical practice and deals with moral dilemmas and professional obligations. It is essential that paramedics understand their ethical framework. Healthcare professionals work under 4 ethical values. These values are reinforced by the ethical principles under Sections 6 to 9 of the Public Sector Ethics Act 1994. When a suspected domestic violence victim refuses transport to hospital, paramedics are forced to question their professional obligations and expectations to function under non-maleficence and beneficence. Domestic violence undermines a victim's autonomy, rendering them as vulnerable. Though most people do retain capacity to make informed decisions, research from Ben Nathan highlights the conflict between upholding patient autonomy whilst ensuring patient safety. Under deontological ethics, we are obliged to follow these principles because they are the law. And under utilitarianism, distributing educational resources on domestic violence to potential victims would bring about the greater good. In 2015, if no female aged 15 and over had experienced partner violence, there would be 41% less homicide and violence, 18% less early pregnancy loss, 19% less suicide and self-harm, 12% less anxiety disorders, 19% less depressive disorders, and 4% less alcohol disorders. The strategy of the non-invasive domestic and family violence information card allows paramedics to respect the patient's autonomy while practicing under beneficence. They are also defending the patient's right to safety and support. In addition, providing this card is ethically right, it aligns with the current legislation and leads to the greatest good.
Created using Powtoon.